Welcome back to our channel, My Health is My Wealth. We are back to discuss again common cancer myths and misconceptions. So let's get into it. Myth: superfoods prevent cancer. Fact: some foods like blueberries, beetroot, broccoli, garlic, and green tea are known as cancer-preventing superfoods. These foods are certainly good for your health and are known to have positive effects in the fight against cancer. A. Containing antioxidants or helping to remove toxic elements in the body. However, it would be naive to look at any particular food as a protection against cancer. Everybody is different and cancer reacts differently in every person. There is no single food or food group that can provide enough protection against cancer. Myth: cell phones, computers, and microwave ovens cause cancer through radiation. Fact: it's easy to see where this myth came from when it was found that the radioactive fallout from the World War II atomic bombs and the Chernobyl meltdown resulted in many cases of cancer caused by radiation. People began to link radiation with cancer. The fact is that cell phones, computers, and microwave ovens only use low-frequency radio waves that do not damage your genes and cause cancer. Many people do not know that there is actually a lot of background radiation around us in the environment, and none of it has been proven to cause cancer. People should be careful in certain areas with high radiation, like in X-ray rooms or certain industrial sites. These areas are usually restricted and marked with radioactive hazard signs. Myth: dyeing your hair can cause cancer. Fact: this myth is a strange one that has some root in the truth. Part of this myth stems from studies done decades ago when information about cancer causes were less common, where certain chemicals used in hair dyes were found to be cancerous in animal testing. Since the 1970s, most of these chemicals have been removed from hair dyes, and modern studies have found no increased risk of cancer in people who dye their hair. Myth: all cancers are the same and can be treated the same way. Fact: cancer is the name given to a group of diseases with the common trait of uncontrolled cell division that spreads into surrounding tissues. Not only are there over 100 types of cancer, but each cancer reacts differently in different people. Even in people with the same type of tumor in the same body part, different types of genetic changes can affect cancer and should be treated differently. This is why a super cure for cancer is very unlikely, and why even the best combination of treatments for each patient can produce very different results. Successful cancer treatment often needs a dedicated and experienced medical team to explore the options and map the most ideal path to recovery. Myth: cancer is very painful. Fact: it is actually quite rare for cancer to be painful. One of the biggest problems is that many types of cancer may have little to no symptoms, and diagnosis may only come at a later, advanced stage. Most of the pain that people link to cancer is the discomfort caused by side effects of cancer treatment, such as chemotherapy and radiation therapy. This pain can be relieved with medication and other pain management techniques. Sometimes, people only focus on the worst examples that they see. Many cancer patients can undergo treatment on an outpatient basis and continue with their daily activities. Different people react differently to different courses of treatment, and it can be possible for a cancer specialist to find a particular treatment that results in the least amount of discomfort. Myth: only smokers get lung cancer. Fact: while smokers may have a very high risk of suffering from lung cancer, they are not the only ones. Your genetic makeup or family history can affect your risk of getting lung cancer. Exposure to substances such as asbestos, radon, uranium, arsenic, and secondhand smoke can also increase the chance of developing lung cancer. There are also cases of lung cancer caused by scarring in the lung tissue due to previous illnesses and slash or infections. Cancer is always fatal. Modern medicine has made huge strides in cancer treatment. Cancer is no longer the death sentence it once was. It is estimated that 40% of people diagnosed with cancer are disease-free in 5 years. The 5-year survival rate is a very important benchmark to predict overall recovery from cancer. Early diagnosis and detection greatly improve the survival rate. So guys, that's all for today's topic. See you soon in the next video. Goodbye.